Module 1. Infection and Inflammation. 1. Chemical mediators of inflammation. Inflammation is mediated by various chemicals such as histamines, prostaglandins, and cytokines. These substances are released in response to tissue injury or infection, leading to the characteristic signs of inflammation. 2. Causes of chronic inflammation. Chronic inflammation can result from persistent infections, autoimmune disorders, prolonged exposure to irritants, or unresolved acute inflammation. It plays a role in various chronic diseases, including rheumatoid arthritis and atherosclerosis. 3. Flu vaccine contraindications. Contraindications to the flu vaccine include severe allergic reactions to a previous dose, an allergy to a vaccine component, and certain medical conditions. It's essential to identify and communicate contraindications to ensure safe vaccination. 4. Antibiotic education. Understanding the appropriate use of antibiotics, including indications, dosages, and potential side effects. Emphasize the importance of completing the full course to prevent antibiotic resistance. 5. Cell-mediated immunity. Cell-mediated immunity involves the activation of T cells, which play a crucial role in recognizing and destroying infected or abnormal cells. This is essential for defense against intracellular pathogens. 6. Function of lymph nodes. Lymph nodes filter lymph fluid, removing foreign particles and abnormal cells. They also play a key role in activating the immune system by presenting antigens to immune cells. 7. Medication. Erythromycin drug-drug interactions. Erythromycin may interact with certain medications, such as statins and antiarrhythmics, leading to potential adverse effects. Module 2. Cardiac 1. 1. Myocardial infarction. Clinical manifestations. Symptoms include chest pain, shortness of breath, nausea, and sweating. Prompt recognition is crucial for timely intervention. 2. Acute coronary syndromes. Clinical manifestations. Similar to myocardial infarction but may also include unstable angina. Diagnosis and management are urgent to prevent further cardiac damage. 3. Coronary artery disease. Risk factors include hypertension, diabetes, smoking, hyperlipidemia, and family history. Lifestyle modifications and medication management are key components of prevention. 4. Medications. Nitroglycerin. MOA. Nitroglycerin relaxes blood vessels, increasing blood supply to the heart. It is used to relieve angina. 5. Medications. Clopidogrel. Patient teaching. Emphasize adherence and the importance of notifying healthcare providers about any signs of bleeding or bruising. 6. Medications. Digoxin. Contraindications. Avoid in patients with certain heart conditions. Monitor for signs of toxicity, such as nausea and visual disturbances. 7. Medications. ACE inhibitors. Adverse effects may include hypotension and kidney dysfunction. Monitor blood pressure and renal function regularly. 8. Medications. Metoprolol. Patient teaching. Instruct patients on proper medication adherence and the importance of regular blood pressure monitoring. Patient teaching. Inform patients about potential side effects and the need for regular follow-ups. 1. Diuretics. Furosemide. Patient teaching. Emphasize the importance of taking the medication as prescribed and monitoring for signs of electrolyte imbalance. Adverse effects may include dehydration and electrolyte imbalances. Module 3. Cardiac 2. 1. Cardiac conduction cycle. Understanding the cardiac conduction cycle is essential for comprehending how electrical impulses coordinate heart muscle contractions. It involves the generation and transmission of electrical signals through the heart's specialized conduction system. 2. Sinus rhythms. Sinus rhythms refer to the normal electrical activity originating in the sinus node of the heart. Knowledge of different sinus rhythms is crucial for interpreting electrocardiograms, ECGs, and identifying irregularities. Module 4. Respiratory 1. 1. Medications. Inhaled corticosteroids. MOA. Mechanism of action. Inhaled corticosteroids reduce inflammation in the airways, making them effective for managing conditions like asthma and chronic obstructive pulmonary disease, COPD. Adverse effects. Potential side effects include oral thrush and hoarseness. Proper inhaler technique can minimize these risks. Module 5. Respiratory 2. 1. Tuberculosis. Treatments. Treatment for tuberculosis typically involves a combination of antibiotics such as isoniazid and rifampin. 1. Ensuring adherence to the full course is crucial to prevent drug resistance. 2. Patient teaching for tuberculosis. Educating patients on the importance of completing the entire course of antibiotics, recognizing and reporting side effects, and practicing infection control measures to prevent the spread of the disease. Module 6. Renal. 1. Urinary tract infection. Prevention teaching. Emphasizing proper hygiene, staying hydrated, and urinating frequently to prevent urinary tract infections. 1. Educating patients on recognizing early symptoms is crucial for prompt intervention. Module 7. Chronic neuro. 1. Terms to know. Nuchal rigidity. Stiffness in the neck, often associated with meningitis. 1. Understanding this term is essential for identifying neurological abnormalities. 2. Migraines, aura, a sensory disturbance that may precede a migraine headache. 2. Recognizing and understanding aura symptoms is crucial for managing migraines effectively. Module 8. Acute neuro. 1. Stroke. Causes. Strokes can be ischemic, blockage of blood flow to the brain, or hemorrhagic, bleeding in the brain. 1. Recognizing risk factors and symptoms is essential for rapid response and intervention. 2. Intracranial pressure, ICP. Clinical manifestations. Increased ICP can lead to symptoms such as headache, nausea, and changes in consciousness. 2. Recognizing these signs is critical for early detection and management of conditions causing increased ICP. Module 9. Endocrine. 1. Diabetes. Complications. Diabetes complications include cardiovascular disease, neuropathy, retinopathy, and nephropathy. Understanding these complications is crucial for comprehensive diabetes management. Hypoglycemia clinical manifestations. Symptoms of hypoglycemia include shakiness, sweating, confusion, and irritability. Recognizing and addressing hypoglycemia promptly is essential. 1. Medications. Metformin. MOA, mechanism of action. Metformin works by decreasing glucose production in the liver and improving insulin sensitivity. It is a first-line medication for type 2 diabetes. Module 10. Oncology. 1. Angiogenic factors. Angiogenic factors promote the growth of new blood vessels. 1. Understanding these factors is crucial in cancer as tumors require a blood supply for growth. 2. Methods of metastasis. Cancer metastasis involves the spread of cancer cells to distant organs. Common methods include direct invasion, lymphatic spread, and hematogenous spread. 3. TNM staging system. TNM, tumor, node, metastasis, staging classifies the extent of cancer. It helps determine prognosis and guide treatment decisions. 4. Cancer grading. Cancer grading assesses the degree of abnormality in cancer cells. Higher grades often indicate a more aggressive tumor. 5. Reed-Steinberg cells. Reed-Steinberg cells are characteristic of Hodgkin's lymphoma. Recognizing these cells is crucial for accurate diagnosis. 6. Tumor markers. Tumor markers are substances produced by cancer cells. They are used for diagnosis, prognosis, and monitoring treatment response. 7. Leukemia. Pathophysiology. Leukemia is characterized by the overproduction of immature white blood cells. Understanding the pathophysiology is essential for effective management. 8. Cancer risk factors. Recognizing common risk factors such as tobacco use, environmental exposures, and genetic predisposition is crucial for cancer prevention. 9. Terms to know. Cancer in situ, anaplasia, apoptosis, adenoma. Understanding these terms is essential for interpreting pathology reports and discussing cancer characteristics. 10. Medications. Antineoplastic medications. MOA. Antineoplastic medications target and inhibit the growth of cancer cells. 11. Medications. Vinblastine. Adverse effects. Vinblastine may cause bone marrow suppression and peripheral neuropathy. Module 11. Hematology. 1. Impaired platelet function. Understanding causes of impaired platelet function is crucial for managing bleeding disorders. 2. DIC. Disseminated intravascular coagulation. Pathophysiology. DIC involves widespread activation of the coagulation system, leading to both bleeding and clotting. 3. Function of ferritin. Ferritin is a protein that stores iron. Monitoring ferritin levels is important in assessing iron status. 4. Von Willebrand factor function. Von Willebrand factor plays a crucial role in blood clotting. Understanding its function is important in bleeding disorders. 5. Cellular components of blood. Knowledge of blood components, including red and white blood cells and platelets, is essential for understanding hematological disorders. 6. Anemia of kidney disease. Pathophysiology. Anemia in kidney disease is often due to decreased erythropoietin production. Recognizing the underlying causes is crucial for appropriate management. 7. Thrombus prevention teaching. Educating patients on lifestyle modifications and medications to prevent thrombus formation is vital in preventing cardiovascular events. 8. Hypercoagulable state causes. Recognizing factors that contribute to a hypercoagulable state is essential for managing conditions associated with increased clotting risk. 9. Deep vein thrombosis. Clinical manifestations. Symptoms of DVT include leg swelling and pain. 9. Early recognition and intervention are crucial to prevent complications. 10. Diagnostic tests. Understanding diagnostic tests, such as D-dimer and ultrasound, is essential for confirming the diagnosis of deep vein thrombosis. 11. Medications. Warfarin. Adverse effects. Warfarin may cause bleeding. 11. Regular monitoring and patient education are essential. 12. Medications. Heparin. Labs to monitor. Monitoring activated partial thromboplastin time, APTT, is crucial. 12. Heparin has a rapid onset and is often used as a bridge to warfarin. Antidote. Protamine sulfate is the antidote for heparin. Module 12. GI. GI tract function. Overview. The gastrointestinal, GI, tract, encompassing the stomach, small intestine, and large intestine, plays a pivotal role in digesting, absorbing, and eliminating nutrients. Importance. Nurses require an in-depth understanding of GI function to assess and manage diverse gastrointestinal disorders. Prostaglandin function. Role. Prostaglandins, lipid compounds, regulate inflammation and gastric acid secretion. Significance. Recognizing the functions of prostaglandins is vital for understanding medication effects and their implications for gastrointestinal health. GERD. Gastroesophageal reflux disease. Pathophysiology. GERD involves the reflux of stomach acid into the esophagus, causing symptoms like heartburn. Clinical relevance. Nurses must comprehend GERD's pathophysiology for effective patient education and management, addressing symptoms and preventing complications. Crohn's disease. Complications. Crohn's disease complications include strictures, fistulas, and malabsorption. Clinical insight. Nurses play a crucial role in identifying and managing these complications to ensure holistic patient care. GI bleed. Risk factors. Factors like peptic ulcers and certain medications contribute to gastrointestinal bleeding. Prevention. Nurses should identify and address these risk factors to formulate preventive strategies and mitigate the risk of GI bleeding. Ulcerative colitis. Treatments. Ulcerative colitis management involves medications, lifestyle modifications, and, in severe cases, surgery. Patient education. Nurses educate patients about available treatments, fostering adherence to prescribed regimens. Gastritis. Causes. Gastritis, resulting from infections or medications, necessitates understanding diverse causes. Clinical insight. Nurses' ability to comprehend gastritis causes enhances their ability to assess and plan care for affected patients. Module 13. Liver, pancreas. Portal hypertension. Ascites pathology. Portal hypertension can lead to ascites, the accumulation of fluid in the abdominal cavity. Clinical relevance. Nurses must grasp the pathology of ascites to manage complications effectively and enhance patient outcomes. Pancreatitis. Pathophysiology. Pancreatitis, inflammation of the pancreas, is often triggered by gallstones or excessive alcohol consumption. Acute clinical manifestations. Recognizing acute symptoms, such as severe abdominal pain, nausea, and vomiting, is crucial for prompt diagnosis and intervention. Liver failure. Clinical manifestations. Liver failure presents with jaundice, hepatic encephalopathy, and coagulopathy. Nursing role. Early recognition of these manifestations enables nurses to initiate timely interventions and provide supportive care. Hepatitis A. Prevention measures. Preventing hepatitis A involves vaccination, good hygiene, and avoiding contaminated food and water. Patient teaching. Nurses educate patients on preventive measures to reduce the risk of hepatitis A transmission. Viral hepatitis. Phases. Viral hepatitis has acute and chronic phases, each requiring specific management approaches. Clinical manifestations. Nurses recognize varied clinical manifestations for accurate diagnosis and tailored interventions. 1. Cholecystitis. Pathology. Cholecystitis, inflammation of the gallbladder, often results from gallstones. Clinical significance. Nurses understanding the pathology play a crucial role in assessing and planning care for patients with cholecystitis. Module 14, Musculoskeletal. 1. Rheumatoid arthritis, RA, Pathophysiology. RA, an autoimmune disorder causing joint inflammation and damage. Nursing considerations. Nurses must understand RA's pathophysiology to assist with disease management and educate patients. 1. Systemic lupus erythematosus, SLE. Clinical manifestations. SLE, a systemic autoimmune disease, presents with joint pain, skin rashes, and organ involvement. Nursing role. Nurses need to recognize and assess these manifestations for early diagnosis and effective management. 1. Osteoarthritis, OA. Pathophysiology. OA, a degenerative joint disease characterized by cartilage breakdown. Clinical manifestations. Recognizing symptoms like joint pain and stiffness is vital for nurses in providing holistic care to OA patients. Gout. Diagnostic criteria. Gout diagnosis involves clinical symptoms, joint fluid analysis, and elevated uric acid levels. Clinical relevance. Nurses need to be familiar with diagnostic criteria for accurate assessments and interventions. Bone mass. Elderly considerations. Aging impacts bone mass, leading to conditions like osteoporosis. Preventive role. Nurses promote bone health in the elderly through education on preventive measures and lifestyle modifications. Compartment syndrome. Pathology. Compartment syndrome involves increased pressure within a muscle compartment, compromising blood flow. Clinical significance. Nurses recognize signs promptly for timely intervention and prevention of complications. 1. Spine anatomy. Understanding. Knowledge of spine anatomy is crucial for nurses in assessing and managing conditions affecting the spinal cord and nerves. 2. Rhabdomyolysis. Clinical manifestations. Rhabdomyolysis involves muscle breakdown, leading to potential renal complications. Nursing considerations. Recognizing symptoms is essential for nurses to provide timely interventions and prevent further complications. 1. Fractures. Types. Understanding different fracture types, like closed, open, and comminuted fractures, is essential for nurses in facilitating appropriate management. Phases of healing. Knowledge of fracture healing phases is crucial for nurses in monitoring recovery and ensuring optimal outcomes. 1. Function of vitamin D. Understanding. Vitamin D plays a vital role in calcium absorption and bone health. Nursing implications. Nurses should be aware of the importance of vitamin D and its impact on musculoskeletal health, particularly in patient education. Module 15. General nursing knowledge. 1. Pain. Elderly considerations. The elderly may experience unique considerations in pain management, including underreporting and altered pain perception. Holistic care. Nurses consider these factors to provide comprehensive and tailored pain management for elderly patients. 1. Herbal medicine. Patient teaching. Educating patients about herbal medicine, potential interactions with conventional medications, and the importance of communication with healthcare providers is crucial. Safety. Nurses play a role in promoting the safe use of herbal supplements and ensuring patients are well informed. 1. Medication administration. Essentials. Proficiency in safe and accurate medication administration practices, including dosage calculations, routes, and documentation, is fundamental for nursing practice. 2. Over-the-counter medications. Advantages versus disadvantages. Understanding the pros and cons of over-the-counter medications is crucial for nurses in guiding patients towards safe and effective self-medication. Patient education. Nurses should educate patients on proper over-the-counter medication use, emphasizing advantages while being mindful of potential disadvantages.